you should continue to discharge your responsibility by contributing as much as possible towards this project.
The vision for the new Masroor Centre for Healthcare is to provide high-quality care at affordable prices for underserved communities in Ivory Coast. Work began in 2013, and by 2017, design began at the selected site. In 2020, the ground was levelled, and last year the perimeter wall was erected and the foundation stone was laid. This year construction has accelerated and the walls have already reached roof level. We urgently need your help to complete the build and go live. Join us on Friday 15th July from 6 to 9 p.m. British Summer Time at www.humanityfirst.org.
Assalamu alaikum wa rahmatullahi wa barakatuhu. May the peace and blessings of God be upon you all. Welcome to the 2022 Humanity First International fundraiser for the Ivory Coast Hospital. We're here bringing you exciting updates, and we hope that you will indeed stay tuned for the entirety of this event. Not only with your selves, but also with your family and friends. So do stay tuned to join us for this event. And as is our practice, we now will start this presentation with a recitation from the Holy Quran, otherwise known as Tilawat, and I am joined by my companion here, Raheel Ahmed.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم إن الأبرار يشربون من كأس كان مزاجها كافوراً عينا يشرب بها عباد الله يفجرونها تفجيرا يوفون بالنذر ويخافون يوما كان شره مستطيرا ويطعمون الطعام على حبه مسكينا ويتيما وأسيرا إنما نطعمكم لوجه الله لا نريد منكم جزاء ولا شكورا. I seek refuge with Allah from Satan the accursed. In the name of Allah, the gracious, the merciful. But the virtuous shall drink of a cup tempered with camphor, from a spring wherefrom the servants of Allah would drink. They make it gush forth, a forceful gushing forth. They fulfill their vow and fear a day the evil of which is widespread. And they feed for love of Him, the poor, the orphan, and the prisoner, assuring them, "We feed you to win Allah's pleasure only. We desire no reward, no thanks from you."
Thank you so much, Raheel. Anytime we are reminded of the reason why we try to do good for other members of humanity, it is the Holy Quran and the acts of good and ordinary people that draw these thoughts back to our heart, back to what's actually important. So here now, we'll be joined by another short video clip. Please have a look.
You should continue to discharge your responsibility by contributing as much as possible towards this project.
The vision for the new Masroor Centre for Healthcare is to provide high-quality care at affordable prices for underserved communities in Ivory Coast. Work began in 2013, and by 2017, design began at the selected site. In 2020, the ground was levelled, and last year the perimeter wall was erected and the foundation stone was laid. This year construction has accelerated and the walls have already reached roof level. We urgently need your help to complete the build and go live 6 to 9 p.m. British Summer Time at www.humanityfirst.org.
Assalamu alaikum wa rahmatullah. Peace and blessings of God be upon you. So as we mentioned earlier, we want to again thank you for joining us for this program. And here in the studio, I am joined by our respected National President, Rafiq Hayat, who's also a trustee of Humanity First International. And of course, to my far right, we have our respected Nasir Deen, who's also a trustee as well. Assalamu alaikum wa rahmatullahi wa barakatuhu.
Wa alaikum assalam wa rahmatullahi wa barakatuh.
So one of the reasons why we are gathered here today, one of the many reasons as a matter of fact, is Humanity First International noted that the local residents over in Abidjan had difficulty finding local clinics, which meant that they didn't have an opportunity to receive the health care that many of them deserved. So that means that they don't have access to trained staff or clinics. And one of the beautiful things that we find here today is presenting you with an opportunity to help build a hospital in that local area. But first, we wanted to perhaps turn to Rafiq Hayat Saab to talk us through about what was the need and maybe talk a little bit first about the history of Humanity First.
Assalamu alaikum wa rahmatullahi wa barakatuh. Humanity First was something that Khalifam C. Rabi Rahimahullah had the inspiration how we're going to help people around the world. And this was his wish that a separate entity should be created, which primary purpose would be to help people around the world. And this came out of the war in Bosnia, where, you know, when the war was taking place, volunteers from here, Khuddam from here, used to go into the war zone with risking their lives to help the poor people of Bosnia who were in trouble. And they used to take, van loads of food, clothing, everything for those poor people who were in them. From that is where the thing started. And then Hazur Aqdas gave it a formal structure and it was called Humanity First. And Alhamdulillah, from its very humble beginnings, when we had very little, we used to do disaster relief around the world. If there was a hurricane somewhere or earthquake somewhere, I remember in the very early stage we had the Kobe disaster in Japan, and at that stage I was also involved with MTA, and we used to do a direct link with our volunteers in ground in Kobe to try and see what aid was being given to the people on the ground. So that is where it's started. It's a very humble organization, and by the grace of Allah, slowly, and all credit to the Humanity First team, it was given good direction by Khilafat, and it started to grow very quickly. And from disaster relief, it felt that it needed to widen its scope and go, rather than just react to things, be proactive and try and deal with the primary sources of problems in the world. And alhamdulillah, I think one of the very first programs were water relief programs that started especially in Africa and Asia, where there is huge problem. Children used to travel half day to collect a can of dirty water, because that was all they had. And by giving clean water, gives them so many different aspects to their life. Is that one, they save a lot of time, and then they having clean water means less disease. It means that it has water for their vegetation, which obviously is very important to their care. And with that came sanitation and other. And now that's been developed into model villages, where we're giving them a whole package of roads and street lights, and it's a dream come true. And then, of course, Humanity First started looking at people had lots of eye problems in Africa. A simple eye operation could sort it out. Here we take these things for granted, but there that would be a main thing, and people would remain blind for many years when a simple small operation could have sorted it out. So Humanity First started doing eye clinics, mobile eye clinics throughout Africa, and by the grace of Allah, that took a different direction, where by the grace of Allah now we established a Masroor Eye Hospital in Africa, in Burkina Faso. Then Humanity First involved itself in the education of children. A lot of schools were opened up in various parts of Africa to give education to children, because education is going to be the key to the progress of that community. So by the grace of Allah, now we have very good schools, and where children are being educated at a very high level, irrespective of color, creed, or faith. And we know that some of the leaders in those countries have been educated in Ahmadi schools, and they talk about it, that we've been through Ahmadi schools. One of the president of Sierra Leone came here a few years back, and with him he had his ministers and the High Commissioner. And we found out that 3 of the ministers and the High Commissioner had been educated in Ahmadi schools, and they were not even Muslims, they were Christians. So it shows the good work that these schools are doing in those countries. And then, of course, the next part of that development was to start giving primary care, health care to the people. And of course, the now very famous hospital in Guatemala was opened by Humanity First, which was a great project, a big challenge, to run a hospital in a foreign country where we don't have the community. But alhamdulillah, it proved to be very successful. I'm told there are now 80 or 90 staff, all locally from Guatemalans, and it's running beautifully. And this project now that we are raising funds for is like a twin from the Guatemala hospital, and this is now for Africa. And inshallah, this will give medical care to thousands of poor people. And the whole objective our khulafas, their whole concern is to help the poor people of this world. And you see that all of the khulafas in their own way, Khalifa Salis, he started the Nusrat Jahan scheme in schools and colleges, or came out of that in hospitals. And then Khalifa Rabi started the Humanity First. And now Khalifa Al-Khamis Talab ibn Aziz is giving great momentum to these projects. We have the IEEE doing projects, we have the Humanity First doing projects, and the primary objective is that we try and help the poor people of this world. And I think by the grace of Allah, this is one of the projects where we're going to see thousands of people over many years who will come and benefit from it. So my request to all of your viewers today is that please give generously, open your heart. This is giving in Allah's way. If you want to please Allah, this is the best way to please Allah. And if you give generously in this respect, Allah will take care of so many of your problems that you will never know, because Allah has already dealt with them before they even arise. Therefore, the experience that we have, especially in our Jamaat, is that people always give very generously for such things. Charity really begins at home, and they open up their hearts in this respect. And I'm very grateful to all of those people who are going to very generously open their hearts again for this project. And I hope and pray that you'll be able to reach your target today. And my prayers are with you. We know that our Khalifa is always praying for such projects. And this project is in his name, Masroor Centre for Healthcare. So it has a special significance. And that is why I would ask people to be more generous in there, because it really fulfills a great need that we have. And may Allah bless everyone who contributes to this project.
Ameen.
Ameen.
Ameen. Thank you, Amir Saab. Nasir Saab, what's interesting is I wanted to ask you about your experiences in dealing with this project and watching this project develop over the last few years. Maybe could you talk us a little bit about that, particularly because for those people who travel to different countries, we often know that our choices of which countries that we go to are often influenced by the level of health care that you might receive if in fact you do fall ill overseas. And oftentimes when it comes to traveling to different countries, we are skeptical or even apprehensive about going to certain places because if you should get COVID, or even if you should drink the wrong water, if you imagine that, then you may fall ill. Now, can you imagine if you should fall ill in another country, what type of problems this now opens for you? Now, if we can just imagine if you live in that country and your day-to-day anxiety is driven by, if you should in fact fall ill, there are no health care facilities for you to go to. So can you talk to us a little bit about your thoughts on why Ivory Coast was suggested and what the whole idea was behind getting them a hospital?
For those who have had the fortune to travel to Africa, most people traveling will have travel insurance, will have some sort of cover. But when you visit these places, and if you have a different eye and look out, if you look out for things that we, for example, in the UK or Western Europe or other countries look out for, where's a local hospital, is there some infrastructure, you will find out very quickly that if you ask somebody where's the local hospital and you were outside, they will say it's maybe 20, 30 miles away. So immediately, as a traveler, and I've had the opportunity to travel in West Africa as well as East Africa and Northern Africa, and other parts of the world which are not so fortunate. Healthcare is something which is lacking in major countries. In particular in Ivory Coast, which I had the opportunity to travel in 2018 for the first time, you could see that the population was very big. Abidjan, originally from what we know, had a population of only about 1 million people. But because of the wars that took place within Ivory Coast and surrounding countries, the population, people who come from the countryside, the livings way of life has suddenly changed, the turmoil meant that the populations within the cities have grown. And they have not just come from within the country, but from surrounding countries as well. And what we saw in Abidjan was a big population, and as Misa mentioned, Ahmadiyya Muslim Jamaat had, and for many years, from the 70s, under the Nusrat Jahan scheme, has a hospital there. And as we'll hear later on, Dr. Bouden and other members of the Jamaat there, it was a basic initial hospital, but there was a need for much higher standard of healthcare, which Amisa has mentioned, of what we're offering in the Guatemala Institute Hospital, there, the Nasser Hospital. And so that was what was required by the population. It wasn't accessible, so the idea is that it can be accessible to the locals as well as surrounding countries. Patients, inshallah, in due time will be able to be serviced as well.
And that's a very good point for us to now segue, because soon we'll be joined in the next segment by the CEO of Humanity First Healthcare, who is actually helping to project manage this. So Captain Majid Saab will be joining us, and I want to really thank you. And to really get this donation appeal going, I'm going to humbly ask Rafiq Hayat Saab to lead us in prayer.
Sure. Will you please join me in silent prayer, please? Please donate generously. This is Allah giving you the opportunity to do something so important for the poor people in Africa. You could change lives of thousands of people there who probably don't receive any health care. And through your efforts in this country, we don't appreciate what a big facility we have in this country. So please give generously so that people in those countries can have a basic system of health care that we take for granted in these countries. May Allah bless you all.
You should continue to discharge your responsibility by contributing as much as possible towards this project.
The vision for the new Masroor Centre for Healthcare is to provide high-quality care at affordable prices for underserved communities in Ivory Coast. Work began in 2013, and by 2017, design began at the selected site. In 2020, the ground was levelled, and last year the perimeter wall was erected and the foundation stone was laid. This year construction has accelerated and the walls have already reached roof level. We urgently need your help to complete the build and go live. Join us on Friday 15th July from 6 to 9 p.m. British Summer Time at www.humanityfirst.org.
Assalamu alaikum wa rahmatullah. Welcome back. And as promised, I'm joined by Captain Majid Khan Saab, who is the CEO of Humanity First Healthcare. Assalamu alaikum, Captain Saab.
Assalamu alaikum. Jazakallah for having me. Thank you.
No, it's our pleasure. And I think we're going to go a little bit more into detail around what it took to get the first hospital, which is the hospital in Guatemala, up and running, and then touch a little bit on the current project at hand, for which we know all of our viewers are vigorously watching. But first, we will observe a few excerpts from the speeches given by the head of the Ahmadiyya Muslim community, Hazrat Mirza Masroor Ahmed Khalifatul Masih, the Caliph of the Messiah.
It has been built with purely one intention, and that is quite simply to serve humanity by providing high quality health care to the people of this nation. In chapter 2, verse 84 of the Holy Quran, Allah the Almighty instructs Muslims to speak kindly at all times, to be considerate of the feelings of other people, and to love and protect vulnerable members of society, such as orphans, children, or those living in poverty or destitution. Thereafter, in chapter 51, verse 20, the Holy Quran states that the hallmark of a true Muslim is that he should care for all of God's creation and should comfort and support those in need, whether they seek their help or not. Hence, it is not enough for a Muslim to wait until someone asks for help. Rather, it is his duty to recognize the suffering of others and to make whatever sacrifices are required in order to help them overcome their challenges or troubles. It will now be clear to all of you that we have not constructed this hospital in order to profit or to gain favorable publicity. Rather, our only objective is to serve the people of your nation by providing high quality health care to the people of this land. Rest assured, any fund generated by the hospital will be used to further serve the people of Guatemala, and not a penny will be sent abroad. Whatever income is received through patient fees will be reinvested to ensure that those who cannot afford treatment can receive it at a subsidized rate, or if feasible, for free. Apart from this, any additional income will be used to maintain and improve the hospital facilities or to fund new ways to serve humanity. Our previous humanitarian projects testify to the truth of what I have said. Wherever we have built schools or hospitals, we have never taken any of the income out of the country. Rather, we have always reinvested it locally in a way that benefits the people of that nation, and the same will be the case here in Guatemala. God willing, this is not the end of our commitment to serving this nation, but it's only the start. Certainly, it is my prayer and sincere hope that this hospital is the first of many humanitarian projects that we establish in this part of the world. I pray that we always continue to increase our efforts to fulfill our duty and responsibility to serve humanity. It is my prayer that Allah the Almighty blesses the hospital in all respects and enables it to go from strength to strength, and that it proves a shining example of service to humanity. I pray that it provides the best possible care for patients, and that the doctors and staff work tirelessly for the sake of providing relief to people, especially to those who are poor and deprived. May Allah the Almighty bless the work of the doctors and medical staff and enables them to heal and cure through His grace. It is my prayer that the administration manages the hospital in a way that the poorest people who cannot otherwise afford treatment are offered heavily subsidized care and, wherever possible, free treatment. This hospital has been named the Nasir Hospital, and Nasir means to help and support others. And so I pray that the hospital forever lives up to its name in all respects. I pray that it develops into an outstanding institution known for its high caliber and above all for its unrelenting commitment to helping the most vulnerable members of society. Moreover, Allah the Almighty and His Messenger Sallallahu Alaihi Wasallam have instructed Muslims to seek to alleviate the pain of those who are suffering from ill health, to provide them with medical treatment, to tenderly care for them, and to regularly inquire after their health. In this regard, the Holy Prophet ﷺ said, "Whosoever visits a sick person for the sake of Allah, a heavenly caller will announce, 'May your every step be blessed, and may you be rewarded with an abode in paradise.'" Not only has the Holy Prophet ﷺ instructed Muslims to provide relief and treatment to those who are unwell, but he has also given the glad tidings that those who make heartfelt efforts to care for the sick will be rewarded in the hereafter. Consequently, those who spend out of what Allah the Almighty has provided them to build hospitals and clinics or to provide health care are those who are actually building their homes in paradise. In light of these Islamic teachings, the Ahmadiyya Muslim community has built many hospitals and schools in different countries.
Assalamu alaikum wa rahmatullahi wa barakatuhu. Welcome back. We just heard from Hazur, our beloved Khalifa, Hazrat Khalifatul Masih V. And one of the things that really stuck out to me was Hazur's extraordinary guidance, not only for the Guatemala hospital, but as we heard earlier from Rafiq Hayat Saab, we heard about the guidance that the Khalifas have invested in humanity first throughout its inception.
Absolutely.
Now, what I wanted to figure out is how has the Khalifa's guidance influenced your vision now when it comes to the Masroor Centre for Healthcare?
First of all, let me tell you, it is very emotional for me to see Hazur again, because we had worked hard for him to come. This was the first Humanity First project he ever inaugurated. And that was the first time ever that he hoisted a flag of humanity first anywhere in the world. It was very emotional. The guidance, whatever guidance, when a man of God says something, I don't know how, but it happens. He said that we should be doing, our customer service should be the best. And if I tell you that today Nasser Hospital is #1 online rated hospital in Guatemala, you will not believe it. It is all what he was saying. It came true because the man of God said that. And whatever the guidance he was giving us, that formed our guiding principle to run and operate Nasser Hospital. The same success we had, now we are trying to build into Masroor Centre for Healthcare in Africa. You don't mind if I say something about Africa before I talk about Masroor Centre? Or
well, before we go into too many details, I think because you'll be joining us later on, where I really want to take the time and uncover a lot of these key points, because I think for our viewers, I think it's very helpful for them to understand not only why Ivory Coast, but why Africa in general.
Absolutely.
And then I'd like to talk a little bit about HF Healthcare and what your vision was and how Hazur's guidance helped to shape the trajectory of that image. But for the meantime, we're going to be joined by our next guest, which is Fazal Ahmed, and we're going to perhaps get a little on the ground feel. And then later, even later than that, you and I will do this really deep dive.
Absolutely.
Into,
looking forward.
it'll be my pleasure. Yes. Well, we're going to bear with us. We're going to take a quick break, and I want to strongly urge everybody to really pay attention to these very fine details, because therein you will find lies the inspiration for helping the people not only of Ivory Coast, but as a matter of fact, the people of the world. So these little stops that we do in Guatemala, we talked about Japan earlier, we talked about Pakistan, and now we're talking about Ivory Coast, Africa. It's really always about humanity and serving humanity first. But we're going to take a quick break, then we'll be back with Mr. Fazal Ahmed, and I'll see you all in just a few moments.
You should continue to discharge your responsibility by contributing as much as possible towards this project.
The vision for the new Masroor Centre for Healthcare is to provide high-quality care at affordable prices for underserved communities in Ivory Coast. Work began in 2013, and by 2017, design began at the selected site. In 2020, the ground was levelled, and last year the perimeter wall was erected and the foundation stone was laid. This year construction has accelerated and the walls have already reached roof level. We urgently need your help to complete the build and go live. Join us on Friday, 15th July from 6 to 9 p.m. British Summer Time at www.humanityfirst.org.
Joining us. Assalamu alaikum wa rahmatullahi wa barakatuhu. Welcome for coming back to us. Right now I'm joined by my very dear friend, Fazal Ahmed, and we're going to talk a little bit about Fazal Saab's experience. But first, we're going to quickly look at an interview with Dr. Bouden. And when we come back, we're going to talk a little bit about Dr. Bouden and who he was and what he did.
few years ago, 30 years ago, the population of Abidjan was 1 million people. Now, with these sequences of war and civil war, people, they have been coming from inside the country, then they have come to Abidjan. And now, this city, this capital, Abidjan, contains 5 million people. So we have infrastructures for 1.5 people. So all this system, they are sort of overwhelmed. Where there are houses, instead of having one family in a yard, we may be seeing 3-4 families staying. So there's overcrowding. Instead, in a room where 1-2 children will be sleeping, you may be having 5 or 6. So there's a problem of overcrowding, and the same problem, they will have a problem of water, they will have a problem of used water, how to evacuate it. So all these factors, they will play ultimately on the health of the children and the family. Now, where we have various studies have been done. Where environment is clean, water is available, you have good health centers. When mothers, they are about to deliver, they don't deliver at home, and they go rush them to the maternity center in a clean environment. They deliver and come back home, they're clean, so no problem of infection, no problem of mortality. But if you have the same family, they don't have the means to go to a maternity center, and they will conduct the delivery at home like they do in villages. So then the mortality and morbidity, the mortality rate increases. And mortality rate, we have done many studies in villages where water is not available, mortality rate also increases because of poor hygiene condition. So the area we have chosen where the land has been purchased is about, Abidjan is an area of 50 kilometers circle. So we are just at the periphery of that 50 kilometers. If you take the airport at one point, where we are having the hospital, it is at the entrance of Abidjan, and this is about 50 kilometers away. We'll have simple blood tests, biochemistry, echography, X-ray, scan, blood bank. We can have other services like maternity, general surgery, medicine, cardiology, pediatry, name it. Any specialist, any specialty can be added to this big hospital. And this, not only this is services to the people, and this will be also a training center. It will be a nursing school for the nurse. It will be a training center for the doctors also. The essence of our program is to service to mankind. So there's a minimum to pay for it, which is much less, 1/10 of what we would have spent. And there are many social cases where nothing is paid. But generally, our service is almost free. Medicine should be practiced in a very clean environment. We have to have a minimum standard of. We know that poor hygiene condition is the source of all infection and all diseases. So we cannot accept poor hygiene condition. When we say very high standard, means very high hygiene standard, and we'll have to spend there. This is the work of Humanity First, and we have already experience in other countries, and we have already success there, and we hope for the same here in Ivory Coast.
Assalamu alaikum rahmatullah. What an extraordinary, extraordinary man. Dr. Bouden served in the Ivory Coast for over 30 years, and his family in Mauritius, as well as his brother in Canada, will be donating, and as a matter of fact, his brother will be calling in later on. But in order to really appreciate Dr. Bouden and understand what serving in Ivory Coast for 30 years means, we wanted to show you those videos, but also here in the studio with me, as I mentioned before, is my dear friend Fazal Ahmed Sahib. Assalamu alaikum warahmatullah. Maybe talk to us a little bit about who was Dr. Bouden and what was your relationship like for him? What did you see or hear him do, and why is what he did so important for us to know?
So Dr. Bouden served for, I think, around 33 years. Unfortunately, we lost him in March last year. But he was the initiator of healthcare services in that country on behalf of the Jamaat. He established the Ajame clinic in the center of Abidjan. And then 10 years ago, he was working with me on finding a location for the hospital. You saw in the video we filmed in 2017 that he was giving the case for the hospital, but he used to go out and do medical camps in far off places like Foroforo and Bouake and so on and so forth. And not just him.
And these are villages.
These are villages where they wouldn't see a doctor for probably 2 or 3 years. So he used to go on the weekend, he used to take his medication with him, he would serve with his team of nurses and so on, and he would do primary care out in the middle of nowhere. And not just him, I mean, Mahmoud Bounoussab also served in Burkina Faso for many years as well. So Mauritius has history in providing doctors who have given exceptional service in West Africa.
And all of this is on a volunteer basis?
No, he was Waqf. He served full-time for the Jamaat.
And when you say Waqf, could you talk to us a little bit about what that means for our viewers? He
dedicated his life to healthcare in Africa, and he was trained. Then he went, and he could have got a job and earned a lot of money in Europe or in North America, but he chose to dedicate his life to Africa, just like Mahmoud did in Burkina Faso. And he had so much love and respect for the patients. He treated all of them as if they were his family members. And honestly, when we lost him in March last year, it was gut-wrenching, because right now he would have been so happy to see the development that we made in Yopougon on this project.
Did he ever mention to you what his motivation was?
His motivation was to serve mankind. His motivation, he was inspired by Khilafat, and as part of his faith, he felt that he had to give the same quality of care that he would expect.
Right.
He would give to his patients, and he loved all of his patients.
Wow. This is, I suppose, a befitting segue, because we're just going to continue to keep this in mind, keep these points in mind, because you're not being asked to go into a small village in Africa that has no healthcare services or even clean running water. You're being asked to help those who are willing to do so continue to do so. So one more time, please do consider all of this very seriously. And as the old saying goes, like for your brother what you would like for yourself. Please donate. And on that note, we'll take a short break and come back.
You should continue to discharge your responsibility by contributing as much as possible towards this project.
The vision for the new Masroor Centre for Healthcare is to provide high-quality care at affordable prices for underserved communities in Ivory Coast. Work began in 2013, and by 2017, design began at the selected site. In 2020, the ground was levelled, and last year the perimeter wall was erected and the foundation stone was laid. This year construction has accelerated and the walls have already reached roof level. We urgently need your help to complete the build and go live. Join us on Friday 15th July from 6 to 9 p.m. British Summer Time at www.humanityfirst.org.
Assalamu alaikum warahmatullah. You know, I had a whole list of questions because, as you can see, I'm joined back in the studio with our dear Captain Majid Saab. And I prepared all these wonderful questions because I really wanted to dig into why Africa, why Ivory Coast, and then talk a little bit about the project itself. But as it so happens, we are now joined by the Guatemala team, and this is the team that is on site at the Nasser Hospital in Guatemala. So first, we may as well give our warm salam and our hello to our team. Assalamu alaikum rahmatullah. How's everybody?
Hello. Hi. Hello.
Hello,
Good to see
Gabby.
you
How
guys.
are you? Good. Excellent. And how's everybody else?
Good.
Okay.
Todo bien.
All right. So, Gabby, we are just short of time. So, would you like to tell the viewers your experience at Nasser Hospital as compared to the other hospitals you have worked?
Nasser Hospital is concentrated in doing things right. As a hospital, we are not directed by economical things on this, so the services for patients and, everyone in the surroundings is about doing the things right, medically speaking. And, as a person, our attention is warm and we take care of our patients like it was family. So I think that's the difference for us with experience in Nasir Hospital.
So you have been working here for the last 4 years, and you have really been the core person of the team here. Would you like to share any message you would like to give to the team at Masroor Centre for Healthcare in Ivory Coast?
So, everything like us, you right now you are starting the project. We wish you a really, really great start when you really give the first steps for attention for patients. Never give up. Try to give your best. The patient is always first. That's our motto here in our hospital. In the management team, we always say patient first. I think that should be your motto, and everything else comes through that action. Everything, management, everything comes if you put the patient first.
Thank you. So when you're talking about patient first, do we have any patients we can talk for a few minutes?
Yes, we have them.
Can you bring them on, please? So,
Sure.
yeah,
Sure.
I would like to, while they are changing the patients are coming in, I wanted to tell you something about this Dr. Gabby. She's the director of the hospital and also the medical director. Initially, when we were starting the hospital, there was a very critical patient there.
Ahorita,
And then she came to me one day after 3 days of that patient being there, and she said, Majid, I want to go home today. So I said, you have not been home for the last 3 days? She said, no, my patient was not well. So that is the kind of leader we have there.
Right.
And I did not know that she has been sleeping in a
On
bed
site.
next to the patient because she wanted to take care of the patient. So that is something which we will be looking for in Masroor Centre for Healthcare as well. People like her, leaders like her, who can really motivate the team.
Wow. I'm already motivated. In fact, I'm even more so motivated by the fact that I think the patient is actually waiting right now to speak to us.
Okay, all right, okay. So, Gabby, do we have the patient there?
Danny is Danny and his mom Nancy. They both are patients from us. As a personal experience, I can tell you that I was a medical doctor for Nancy in one occasion, and for Danny, it's our nephrologist. He couldn't be here, but Danny right now is waiting his last test for doing his kidney transplant. He will be our second patient with kidney transplant, and we're waiting some compatibility labs.
So that means that the hospital is now shifting gears and going towards more complicated cases, right? Is that correct?
Yes. Funny thing, Mike, is that our patients are always complicated patients because of the hospital, the kind of hospital we are. Harder patients come to our emergency in our doors.
So you think you can ask any one of the patients what experience they've had at the hospital? Just anyone, because we are, again, as I said, we are running short of time.
I will make the question in Spanish. A la gente le gustaría saber cómo ha sido su experiencia con nosotros.
Bueno, su experiencia ha sido muy buena. Veníamos necesitando ayuda. No contamos con los recursos necesarios para el tratamiento.
Nancy was telling me right now her experience has been really good. They did not have a lot of resources, and here they have found support and resources for this particular situation.
Okay, yes. That's what we stand for, right? If somebody needs
Yes.
help, we extend our help to in whatever way it's possible. Okay, thank you. Thank you very much. Okay, guys, thank you very much. Say hello to both Danny and the other one. And we are hoping that in the next couple of weeks, we will have our second kidney transplant surgery at the hospital, God willing, inshallah. Okay, all right. Take care.
Wow, that's extraordinary. I remember earlier today you were
Yes.
telling me that's Daniel who's
Yes,
getting the
yes,
kidney
yes,
transplant.
yes.
And this is the first. What's extraordinary about this particular story is that Daniel was the first kidney transplant.
No. He is going to be the second kidney transplant
Oh, he's going
patient.
to be the second.
Yes. The first is already been very successful.
Wow.
Yes. So we are now becoming a sort of a center which is focusing on more complicated cases.
Wow.
So and that speaks of that our number of emergency visits are going up much more than what it was last year.
Wow. So on that same note, we've got yet another team, and this, in fact, is the Ivory Coast team.
Yes.
They're on the line now. Assalamu alaikum. How's everybody?
Assalamu
Can you hear
alaikum.
us? Okay. So I think we're
yes,
we're
yes,
going to
while
sort
we're
out.
going-
There's
yes.
some connection issues
Right,
there.
right.
So maybe tell us a little bit about, while they're getting all set up, maybe tell us a little bit about who it is that we're about to meet, and maybe some highlights, quick brief highlights about the Ivory Coast team.
So that is, for now, it is mostly going to be the ground team which are doing the construction part. And I'm hoping that maybe one or two neighbors would also come along.
Are these people coming in from outside of the
Yes.
Ivory Coast
Yes.
to help, or are this like a local
No, it's
support?
a local team.
Oh, so these are all local teams?
Yeah, the all local team except one person who has come from Pakistan to oversee the construction part.
But I mean, that's a bit extraordinary.
Yes.
Normally, when you have large projects like this, I mean,
Yes.
think about this, ladies and gentlemen. They're building a hospital, right? So normally, what ends up happening is organizations will sort of import the workforce
Yes.
into that area. And so here, one of the benefits of using local staff is that you're also contributing to the
Of
economy.
course,
Is that
of course.
right?
Yeah, absolutely. I think they were online. No, I thought they came online for a while, and maybe the audio was not working.
That's
But
all right. We're still getting the audio
yes,
together.
Yes, you know, that is Africa. There are challenges, and
Sure.
you have to overcome the challenges and turn them into opportunities.
Right.
So yes, so we are at a stage. We have reached the roof level, and
So this is the second part of this, and in fact, I just want to remind our viewers that the reason why that this now update is so key is because some time back when we first started this project, we appealed to everybody to donate, to
Yes.
really help us out in this project, and as a matter of fact, help yourselves out, because by contributing to build a hospital
Absolutely.
directly is an extraordinary opportunity, not only for yourselves, but also for your families, because we all sort of pay taxes and we just expect it to just go, you know, wherever it goes. But when you're looking at myself, you're looking at Captain Majid Saab, you're meeting the teams on the ground, this is a result of not only your prayers, but also your direct donations. And you will be able to say for yourself as well as for your family, that yes, we participated in the building of those hospitals. So when you're meeting these people, Daniel and some of the teams on the ground in Guatemala, you're about to meet the teams over in Ivory Coast. This is a result of your prayers and your donations. So maybe tell us a little bit about the team that we're meeting, and maybe some of those early challenges, like you say,
Yes.
this is Africa.
So the early challenges was, of course, you know, when you decide a project, we need to have a project which is sustainable.
Right.
So the sustainability for any future project of humanity, first for any non-profit, the project has to be sustainable if you want to make it successful.
Right.
Otherwise, the size of the projects we are taking up, and I wanted to talk about that as well, because why are we taking up the project of this size? Because we want to make it sustainable.
Sure.
If we don't make it to a certain size and level, then we will never be able to make it sustainable. And the way we did it at Nasser Hospital, this has the potential of going further, because it is Ivory Coast overall has a better economy, but has also a huge young population.
I see. So is that the reason why you, or the entire team and all of the project teams involved, is that the reason why they went with a sort of medium to large hospital as opposed to a small hospital? Oh, I think we might be joined by our teams. Not yet.
Yes, not
so
yet.
Is that the reason why we went
yes.
for like a medium to large hospital as opposed to a small hospital?
No, actually, when you talk about a 30-bed hospital, it's not even a small hospital.
Oh, right.
It's a micro hospital.
Right.
So because for us, because we are going to the next level, a 30-bed hospital is a challenge to do. But if you are talking about the scales of the hospitals, then a 100-bed hospital is called a small hospital.
Sure.
And anything, and then there are medium and there are big ones as well.
Okay.
So, but you have to have that minimum number of beds and also all the diagnostics in place to give it that potential
Right.
to be sustainable at some level.
Oh, I understand.
So unless you give it that potential, it will never be sustainable. And Humanity First does not have a choice, because the operating cost of this hospital could be more than the Humanity First budget. So that is why it is important that it must be sustainable. That is why it is important, and more so, the infrastructure investment in Africa is very, very important. Unless you have a hospital of this size, you are not actually contributing to the infrastructure.
Wow. So then, maybe perhaps this is a good opportunity to remind our audience, what size are we looking at when we talk about building this Masroor Centre in the Ivory Coast?
So it's a $3.6 million project.
Wow.
And and there are ways of donating. You can have like this. You can have a brick donated to and have it dedicated to your family, to your loved ones. And this and remember, this is a Sadqa Jariya also. Because,
and what does that mean?
Well, it is Sadqa Jariya means a benefit or a sadqa which is continuous.
Wow.
So whether you want to give it for your loved ones
Sure.
who have passed away, or you in their memory, or you want to honor someone, or you want to give it in your own name. So we have a couple of options for the donors. It starts with bronze and gold, goes up to.
Well, let's see some of see some of those options. So let's start with the bronze one.
So the bronze one is 1,000 pounds.
Okay, right.
Then we have silver.
Okay.
And then we have a gold, which is 3,000 pounds.
Right.
Then we have, this is platinum. And then we have a diamond, which is 10,000 pounds each. And obviously, there's going to be a wall in the reception, which will display all the bricks. And the bricks will come in different colors as well as in different sizes. So this is one way you can donate. And as Amir Saab was saying before, this is not a sacrifice.
Right.
This is an opportunity.
That's right.
The opportunity to be part of something which you and your generation will benefit from.
Now, it's funny that Majid Saab brings up this point, because you'll note that on the screen there is a picture of all of the various ways that you can donate, whether you are an individual or whether you are an organization. And we have here all of these lovely colored bricks. We've got bronze and silver, and then you got the gold and platinum, which not, in fact, are the colors that you see here. But the colors also represent the level of donation which we want to recognize. But the true reward, in actuality, doesn't come from the color of the brick. It comes with the intention matching the donation that's being given, whether it's £5, 1,000 pounds, 2,000, 3,000, 5,000, or 10,000, right? This is the most important part. And what you've just seen on the screen are the different rooms: triage room, x-ray room, x-ray room. You have all of the different ways that we'll talk about a little bit later on that you can donate. But most importantly, we would urge you to go ahead, make a donation, no matter how small or how large, each one to his means. As you see there on the screen, you've got the x-ray room, endoscopy room, you got the pharmacy, the laboratory, you've got the triage room, the patient rooms. All of these are at various price points, and we would strongly urge you, be a part of this project, not only for yourselves, but also for that of your families.
So there's something which I would like to add to this, if you allow me. They can dedicate the rooms to their families, to the loved ones, but they can also have co-branding with some corporations, the companies they work for. If I'm sure there are, like what we do in USA, that companies match the donations.
That's right.
Maybe there are some companies who match your donation. And there could be some companies who would like to have a suite in their name. So we can also think and we can discuss and we can have the option of some corporations coming in for the co-branding.
Those are great ideas.
And there's one more thing I would just like to mention. This is a great event. This is an event which is forming the basis of the largest humanitarian project taken up by Humanity First in Africa. This is not something which you should miss.
Right.
And there, Humanity First UK, Humanity First Canada, and Humanity First International, all three have come together for this. It is something which, and there's something which I think of, that when you take something, there is a human nature of selfishness which comes in.
Right.
When you give something, then you are selfless. So the more you give, the more you are selfless. And I would request the donors to think from their heart. Be part of this huge humanitarian initiative. Because this is going to, this is what the future is. This is what your future is. This is what the future of African people is. And you are becoming part of a project when your children, they
That's
go
right.
to that place, they will see that their fathers and forefathers had contributed in the first humanitarian project which was ever done.
Well, speaking of the future, we're going to take you to a quick 3D representation of the Masroor Centre, and why don't you have a look yourself?
Salam alaikum rahmatullahi ta'ala barakatuh. Ntogo diara siriba. Vraiment en content parce que ñani ani docteur so cheka jam. Souvent banabagatɔ b'i bolo sufɛ I malo bɛna kɛ cogo ma. Muso bɛ wuli jigili la sira tɛ mobili ko ka gɛlɛ. Muso dɔ yɛrɛ jigila an bolo ɲa vraiment c'était pas la peine la tun man ɲi. Donc tiɲɛna an b'a la fo ka Ala waleɲuman lɔ docteur so ni min mina lɔ Ala ye barika bila la. Ala ye barika.
You should continue to discharge your responsibility by contributing as much as possible towards this project.
The vision for the new Masroor Centre for Healthcare is to provide high-quality care at affordable prices for underserved communities in Ivory Coast. Work began in 2013, and by 2017, design began at the selected site. In 2020, the ground was levelled, and last year the perimeter wall was erected and the foundation stone was laid. This year construction has accelerated and the walls have already reached roof level. We urgently need your help to complete the build and go live. Join us on Friday, 15th July from 6 to 9 p.m. British Summer Time at www.humanityfirst.org.
Je m'appelle Doumbia Ali. L'hôpital, dans ces quartiers, vraiment, nous sommes beaucoup contents. Si dans quelques temps, peut-être, si Dieu nous a aidés, ça va finir, ça va beaucoup arranger les parents du quartier. On est dans un grand quartier, il n'y a pas d'hôpital, il n'y a rien. Donc vraiment, si cet hôpital finit, Inch'Allah, ça sera vraiment quelque chose de très bon pour les habitants d'ici. Bon, vraiment, on a beaucoup une difficulté à ce niveau dans le quartier. D'abord, il y a le problème de route. Et puis le deux, quand il y a ce genre de cas tardivement, c'est un peu difficile parce que les centres de santé qui sont vers ici, ils sont un peu loin. Vous voyez, ils sont un peu loin. Donc, d'ici, on va quitter ici. Moi, mais j'étais dans le problème. Quand je suis tombé malade, j'ai eu ce problème. On a eu des véhicules pour aller, mais d'ici, on va arriver là-bas. Vraiment, il y a beaucoup souffert. Donc, l'hôpital dans le quartier, dans le secteur ici, c'est une bonne chose. Vraiment, nous prions que cela finisse vite. Ça va beaucoup soulager la population de ces quartiers.
السلام علیکم ورحمۃ اللہ وبرکاتہ. ویلکم بیک اس لائیو ٹیلیتھون میں. سارے سامعین کو بہت خوش آمدید. میرے ساتھ موجود ہیں اس وقت ڈاکٹر شکیل. ڈاکٹر شکیل جماعت کی بہت عرصے سے خدمت کر رہے ہیں.
شکیل شیخ لطیف الرحمان.
شیخ لطیف الرحمان صاحب بہت دیر سے جماعت کی خدمت کر رہے ہیں، اور یہ آج اسٹوڈیو میں میرے ساتھ اس لیے موجود ہیں کہ انہوں نے اللہ کے فضل سے 10,000 پاؤنڈ کا عطیہ دیا ہے اس ہسپتال کے لیے. تو آئیے ان سے بات کرتے ہیں. تو پہلا سوال آپ سے یہ ہے کہ آپ کو کیسے خیال آیا اس ہسپتال میں یہ عطیہ دینے کا؟
اعوذ باللہ من الشیطان الرجیم، بسم اللہ الرحمن الرحیم. ایسا تھا کہ ہماری تو جو بچپن سے پرورش ہوئی ہے وہ ہوئی اس طریق سے ہے کہ حقوق اللہ اور حقوق العباد جو ہیں ان کو نبھانا ہے، اور ان کو نبھانے کا جو طریق ہم نے سیکھا ہے وہ یہی ہے کہ جسمانی قربانی بھی کرنی ہے اور مالی قربانی بھی کرنی ہے. تو چونکہ خدا تعالیٰ نے ایسا کوئی سامان پیدا کیے ہیں کہ حضرت خلیفۃ المسیح الرابع رحمہ اللہ تعالیٰ جب اس ملک میں آئے تب سے ہی ان کے زیر سایہ خدمت کا بھی موقع ملتا رہا، اور تربیت بھی اللہ کے فضل سے ہوئی، بڑی قریبی وقت گزارا. تو جب اس ہسپتال کے بارے میں تحریک ہوئی تو میرے دل میں تو سمجھتا ہوں خدا تعالیٰ کی طرف سے ہی ہمیشہ انسان کے دل میں نیکی کی خواہش پیدا ہوتی ہے اور تحریک ہوتی ہے. تو میرے دل میں یہ خواہش پیدا ہوئی کہ ماں باپ کے نام کے اوپر جو ہے وہ کوئی نہ کوئی اس طرح کی خدمت جو ہے وہ کرنی چاہیے. تو الحمدللہ اللہ تعالیٰ کا شکر ہے کہ اس وقت میرا خیال ہے 10,000 پاؤنڈ شاید سب سے بڑا ہی عطیہ تھا شاید اس وقت جب یہ لانچ کی ہے اس کی اپیل. تو الحمدللہ یہی وجہ ہے، اور تو ہمارا کام ہی یہی ہے.
جزاک اللہ. نہیں، اللہ تعالیٰ نے آپ کو توفیق دی ہے، یہ اللہ تعالیٰ کا بہت بڑا فضل ہے، اور ہم سب کے لیے ایک بہت اعلیٰ مثال بھی ہے. آپ نے اس سے پہلے جو گوئٹمالا میں ہسپتال بنا تھا
جی
اس میں بھی آپ نے کوئی ڈونیشن دیا تھا؟
میرا خیال ہے میں ہیومینٹی فرسٹ کے لیے مختلف مد میں دیتا رہتا ہوں پیسے.
ٹھیک.
تو اب چونکہ گواٹے کا تو کافی پرانا معاملہ ہو گیا, اب میرے ذہن میں نہیں ہے کہ کوئی ذاتی میں نے اس کے لیے کوئی خاص رقم دی ہے, لیکن الحمدللہ جو آرگنائزیشن کے چیئرمین ہیں احمد یحییٰ صاحب ہیں, نصیر الدین صاحب ہیں یا شبیر بھٹی صاحب ہیں ڈاکٹر, سب کے ساتھ ہی ذاتی تعلق بھی ہے. تو اس معاملے میں ہر وقت ہی کوئی نہ کوئی تحریک تو آتی ہی رہتی ہے, آپ کو بھی علم ہے. میں یہاں ایک چھوٹی سی بات کہنا چاہوں گا, وہ یہ ہے کہ اللہ تعالیٰ نے جو انبیاء علیہ السلام کا سلسلہ جاری کیا ہے, اس میں خدا تعالیٰ جب انبیاء کو بھیجتا ہے اور نبی آتا ہے, اور ہم ان خوش قسمت لوگوں میں سے ہیں جنہوں نے حضرت مسیح موعود علیہ السلام کو مانا اور پھر خلفاء کو دیکھا. تو اب خلیفۃ المسیح الخامس کا دور ہے, یہ بھی ایک اسلام کے لیے نئی چیز ہے, کیونکہ 5واں خلیفہ تو خلافت راشدہ میں بھی نہیں ہوا. تو بڑی بابرکت ایک خدا تعالیٰ نے نعمت نازل کی ہوئی ہے. تو جب یہ دور شروع ہوتا ہے تو اللہ تعالیٰ نبی کو 2 مقاصد کی خاطر بھیجتا ہے کہ انسان کی جو روحانی اصلاح ہے اور تکلیفوں کا مداوع ہے وہ بھی نبی کرتا ہے اور جسمانی بھی کرتا ہے.
بے شک.
تو یہ تو میں سمجھتا ہوں ہر احمدی نے دیکھا ہی ہوگا اور سنا ہی ہوگا, اور بعضوں نے شاید ایکسپیرینس کیا ہو. شاید اب مجھے نہیں پتا کہ صحابہ حضرت مسیح موعود کے اب بھی کوئی موجود ہیں یا نہیں, لیکن ان کے زمانے سے ایک جسمانی تکالیف کو دور کرنے کا سلسلہ بھی جاری ہے. آپ کو شاید پتہ ہی ہوگا اس بات کا کہ نبی حضرت مسیح موعود علیہ السلام کے زمانے میں حضور ہومیوپیتھی بھی اور ایلوپیتھی کی بھی دوائیاں یورپ سے منگا کے اور خدمت کرتے تھے. تو اسی طرح بڑا کلوز وقت گزرا حضرت خلیفہ رابع کے ساتھ. انہوں نے اپنی جو ہومیوپیتھی کی کلاسز شروع کیں, پھر بے شمار یہاں خدا کے فضل سے یورپ میں سارے میں اور پاکستان میں اور ساری دنیا میں جو ایک جسمانی تکالیف کو دور کرنے کا ایک نظام ہے وہ جاری
ہے. اور اللہ تعالیٰ نے آج آپ کو 10,000 پاؤنڈ کا ڈونیشن دینے کا ہم سب کے لیے ایک نہایت قابل تقلید نمونہ. بہت شکریہ آپ کا, جزاک اللہ کہ آپ اسٹوڈیو تشریف لائے اور آپ نے ہمیں ٹائم دیا. We are now going to go to play a video. It's called Life in Ivory Coast. اب ہم ایک ویڈیو کی طرف جائیں گے جس کا ٹائٹل ہے کہ زندگی آئیوری کوسٹ میں کیسی ہے.
Ordinary people in rural Ivory Coast lead very simple lives. Villages such as this one consist of basic homes and some shared communal facilities. We take access to clean water on tap for granted. But here in Ivory Coast, without a local borehole, women and children will often walk 2 to 3 miles to the nearest stream. The poor quality of the water leads to many health issues, and poor hygiene and sanitation is also a major risk for pregnant women. Humanity First Ivory Coast regularly sends teams of engineers to the provinces to improve or replace water boreholes in villages. This is a traditional water hand pump, but we also install foot pumps and now solar boreholes that need no pumping and last a lot longer. And the quality of water, once it's filtered, is much, much better than what they used to access from the streams. Many children miss out on education, especially in rural areas, if the nearest school is too far away. Humanity First has built over 80 schools, including 3 here in Ivory Coast. Life expectancy has been improving in the last 20 years, but still, too many villagers die of basic, treatable health conditions. A combination of the COVID pandemic, climate change, and now the Ukraine crisis have exposed weaknesses in food supply in these areas. Although Ivory Coast exports cocoa, coffee, palm oil, bananas and cashew nuts, the country still relies heavily on imports of rice and cereal crops such as wheat. Humanity First has deployed dozens of crop grinding machines to help women turn products like cassava, rice and maize into higher value products. Machines like this one save women a huge amount of time that they can then spend on themselves and their children. They can invest the extra income from their harvests on their own health and the education, healthcare and welfare of their children. Expectant mothers in the region suffer when there is poor hygiene and sanitation in the village, or poor quality drinking water and insufficient food available. A combination of Humanity First projects covering agriculture, water, education and healthcare is reducing poverty and improving lives. These are the kinds of communities that the new Masroor Centre for Healthcare in Yopougon-Jesco will be serving in Ivory Coast.
Assalamu alaikum viewers, and welcome back to the Humanity First telethon for the Masroor Centre for Healthcare in Ivory Coast. We just saw a very interesting video about daily life in Ivory Coast, and I'm joined here by one of our directors from Humanity First International, Fazl Ahmed Saab, who's spent a lot of time in Africa and indeed in Ivory Coast. Fazl Saab, we saw glimpses of you in that video.
Fortunately,
yeah. Fortunately, I'd say. And you know, can you tell us a little bit about what life is like, daily life in the Ivory Coast?
So I mean, you saw there what village life is like, and actually, when you talk about healthcare, just imagine from those villages, the road that goes 50 miles to the nearest hospital is boom, 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 boom. So if you're a woman about to have a baby, that's the last thing you want to do. So it's a combination of the roads and how far away hospitals are means that most women don't go for checks and have babies at home. And that's what we were showing. And if you're having a baby in the village and the water quality is poor, that compounds the risk. You know, and if you have complications like postpartum hemorrhaging, this is where women are dying. so many women are dying in childbirth. So this is what we're trying to address with the new hospital. And we need you guys to donate. We're at over $45,000. Please keep donating. It's going to make a big difference to the hospital.
No, indeed. And that is the purpose of today's telethon. It is really to raise funds. And this hospital is going to provide a lot of the services that we here, in the UK, for example, take completely for granted. And sadly, lots of people lose their lives and suffer as a result of things which are totally avoidable if the facilities are in place. And that's what we're seeking to achieve today.
And it's not just the mothers. So many children don't make it to their 5th birthday. We talk about maternal mortality, we talk about pediatric mortality. These are children who, for very simple reasons, won't even live to the age of 5. We wouldn't accept that here. We wouldn't accept it for our kids. So we should expect the same care in Africa as we would want here in Europe or in America or in the Middle East or in Australia. And that's what we're trying to do. This hospital is about providing the same quality of care, but subsidizing the care using private patients.
Indeed, and I know that we've got a very interesting slot later on in the show with a doctor, a lady doctor from Africa, who can give us some first-hand experiences around what women have to face in terms of giving birth in Africa and the facilities that are available, and hopefully that will give our viewers a good sense of why this project is so important to people that live in the Ivory Coast. And I believe we've actually got some callers. We've got a live call coming in from Mauritius, I believe. Dr. Sadiq Bouden is on the line. Yes, and I think we're live through. Assalamu alaikum wa rahmatullah. Well, welcome to today's telethon for Humanity First. We're delighted that you're joining us all the way from Mauritius by the grace of Allah. Dr. Sadiq, I understand that you have a personal connection with this project because your brother was involved in some of the early thinking around this project. Can you tell us a little bit about him?
Assalamu alaikum wa barakatuh. Thank you for giving me the opportunity. I just read Persian, and I'm very pleased to be on this program today. I just want to say a few things about my brother, Dr. Nizamuddin Bouden, who, as you all know, passed away last year. Huzur, just before his funeral, gave a resume of whatever he achieved, and I would encourage you to view that. He was a very bright student, and in 1968, he got very good grades in Mauritius, and he decided to go to Pakistan to study medicine. When he finished in 1977, he met Khalifatul Masih al-Salis Raztalanho, and the Khalifa told him to go and serve Jamaat in Africa. This is when he went to Lagos and started there his African journey. Then in 1980, Hazrat Khalifatul Masih Salis Rahmatullah alayhi visited Nigeria, and people requested him to send a doctor to Abidjan, Ivory Coast. And my brother was French speaking, and Khalifatul Masih Salis requested him to go to Abidjan. There were a lot of paperwork, so he finally made it there in 1984. In 1988, Hazrat Khalifatul Masih Rabi visited Abidjan. More recently, in 2018, I had the opportunity to visit Abidjan. And my brother brought me to Yopougon, in that very place where now we have the Masroor Centre. And it's quite emotional to see how difficult life is over there. Even where my brother worked in Ajami, the roads are terrible. And he told me that people sometimes have to travel for days to come to his to get treatment. So Interestingly, after I saw him in Abidjan and he showed me that site, I went to Guatemala for the inauguration of Nasser Hospital. So I hope, inshallah, the hospital in Abidjan will deliver just like the Nasser Hospital in Guatemala did. This was very dear to my brother, and I hope this will be a game changer in Africa, inshallah.
And actually, you stayed in the same hotel as me in Antigua in Guatemala.
That's correct. This is where I met Fazal Ahmed for the first time.
I think your brother would have been so proud to see how much progress we've made in the hospital now.
Absolutely, because he dedicated a lot of time to that very project.
And he spent so many years there that he was considered an Ivorian. He was loved by all of the communities there.
Yeah, he served about 43 years in Africa and short of 40 years in Abidjan.
It's just amazing. And I understand you're fundraising on his behalf as part of his legacy.
Yeah, we did that, but I think Moise can talk about that better.
Yes, Alhamdulillah. Alhamdulillah, we have been very pleased to participate in this fundraising because we feel we have a special bond with this hospital. The fact that one of our Mauritians has been the pioneer doctor, if you want, in Abidjan, as Khalifatul Masih Rabi spoke of him in one of his letters to him. And we have been able to raise up to now $20,000. And I just hope that we can, if this continues like that, we can exceed it. But for sure, inshallah, we will be able to meet this $20,000 target that we made for us sometime. Just hope that Allah we can make it better.
Mashallah, that is truly inspirational. $20,000 raised by members in Mauritius for this hospital. That is a truly astonishing amount and is going to make a real difference. And I will ask our friends and brothers in Mauritius if you would be interested in co-branding one of the parts of the hospital with this amazing amount that you've raised.
Sure. We've spoken with the committee, and we think that it's befitting that we will be using it for one of the areas of the hospital. And inshallah, it will be a great tribute to Dr. Nizam, because we can have his name there in the hospital, so that the whole Côte d'Ivoire, Abidjan, can remember him for long, inshallah.
Inshallah.
Youngsters coming through who want to serve in Africa, following in his footsteps. That would be a fitting legacy.
Yeah, it's true, but I have to say that we do have Akib Jawaya, who is there.
Replacing him.
He's replacing Dr. Nizam Bouden. I think the history of Mauritius and Abidjan, the link, is going to continue for a long time, inshallah.
Inshallah. What a wonderful legacy that has been left behind by Dr. Sahib there in Ivory Coast, and it's so nice that members of his family and his friends and his colleagues back in Mauritius have made this special effort. And Fazal Sahib, what just can you give our viewers an idea? £20,000, or beg your pardon, $20,000. What will that be able to do in the hospital? You know, what could that contribute towards in terms of the actual facility itself?
I mean, $20,000 is going to help us with a clinic area. You know, so building and equipping an outpatient clinic area. But I'm hoping that the Mauritius community will raise even more. And you know, don't just see what you can raise now. We're looking for pledges over the next 12 months. So if in 12 months you can double that to 40 or 50,000, then we can go for a bigger part of the hospital and attach Dr. Boudin's name to that as a permanent legacy to what he's done in Ivory Coast. So you know, all of the services that we're looking at, even the quality of equipment we're looking to put in, is going to make a big difference.
Inshallah. Inshallah. No, that's what a wonderful effort that's been made in Mauritius, and actually staying in the continent. We're now, I believe we've got a call coming in from Kenya, I believe, and we have one of our medical doctors in Kenya on the line to speak to us.
Assalamualaikum.
Waalaikum salam wa rahmatullah.
Assalamu alaikum, Dr. Atia, are you on the line?
Waalaikum salam, can you hear me?
We may be having a bit of difficulty getting through to Dr. Oh no, I'm told she's there. Hello, assalamu alaikum.
Waalaikum salam, I can hear you. Can you hear me?
She's actually based in Kenya, in Nairobi, but she works in the provinces as well. So I don't know where she is right now. Hope she's got decent signal.
Yeah, I understand that Dr. Atia can hear us, but we can't hear her. So hopefully, assalamu alaikum. Assalamu alaikum, Dr. Saiba, are you there?
Waalaikum salam, can you hear me now?
Yes,
we can
hear you loud and clear.
Oh, perfect.
So Dr. Atia is actually our head of medical services for Humanity First in Kenya. Dr. Atia, it would be great if you could, you know, one of the focus areas for this hospital is going to be maternal services and services for women and young children. Could you describe what the normal experience of women patients is in parts of Africa?
Yeah, I mean, I've had the opportunity to work with the reproductive health services for quite a while now, alhamdulillah, and my focus has been women in the socially disadvantaged communities. We're talking street women, refugee women, women living with HIV and AIDS, slum-dwelling women. So through this, I've really been able to appreciate the problems they face at the very grassroots level. So I don't really need to explain why maternal health is important. I mean, there's a reason why it's ingrained into the very sustainable development goals. So I will just speak about maternal health in Africa, but my references will be mainly in line with the situation in Kenya, but that could be extrapolated to other African countries, mostly in the eastern part of Africa. I like to believe that the African woman is truly the most resilient of her kind. And I understood this for myself in my medical practice in my school. We are usually posted to very remote villages for a period of time, and we have to spend time in the community and really get to know them and understand the challenges they face in healthcare and address them. So I noticed at this point that it was the women who were, cleaning the houses. They were the ones cooking and putting the kids through school. They were working in the farms and, taking care of the livestock and selling the produce in the market and still walking miles and miles to fetch water. And while the men had a very passive role in all this, almost non-existent, I should say. And it was really shocking to me that they were bearing all these responsibilities while at the same time dealing with so many challenges. And challenges that have to do with the culture, including cultural practices like female genital mutilation, problems like life inheritance brought about by culture, problems in utilizing services such as contraception because their husbands wouldn't allow them to use this, the contraceptive methods. I remember a woman once came to me at the hospital and she had her arm was bleeding, and it turned out that she was using a contraceptive internal, and her husband found out, and he literally slashed it out of her arm. So they have a lot of such problems that they face, and also amongst these problems is the high rates of sexually transmitted infections, especially HIV, and this is very endemic to the Western region in Kenya. So there's just a whole lot of challenges that these women are facing. So of course, when this happens, they tend to sideline their own health. So I realized that as a healthcare provider in humanity first, we can't really do much to change their social circumstances, but we can at the very least, provide them with adequate healthcare services. Yeah, so exactly. I hope so that through this hospital, we can at least do that, because that's the absolute least we can do for them.
Jazakallah, Dr. Saiba. So could you just tell us what difference this hospital is going to make for the women in that area?
Yeah, absolutely. So maybe I can tell you what the biggest problems are that women are facing and how they can be addressed. So just to give you a few statistics, the WHO states that 68% of the maternal deaths globally are confined to sub-Saharan Africa alone. So it's important to recognize that we've come a long way from them, and we've made huge accomplishments so far, but there's still a long way to go. We still have a lot of deaths. We have about 800 women in Africa still dying on a daily basis, and these are all preventable deaths. So it really begs the question that if these deaths are preventable, why are they still so prevalent, and why are they still so persistent? So there's three factors that I would say are the biggest contributors to this. So the first one is lack of information. We have a lot of women who are still not properly educated, especially at the community level, about the importance of antenatal care. What happens if my water breaks? Do I need to seek help? What happens? What's the importance of seeking, the regular antenatal care? They need to be taught the importance of the supplements they're taking, the malaria prophylaxis they're taking, because without that, you're not really doing anything. So we really have to put more emphasis into educating these women, and that has to be an integral part of our approach. The second thing is the lack of access and availability of medications and skilled healthcare professionals.
Jazakallah, Dr. Saiba. Thank you so much for joining us. I'm sure that was very insightful for our viewers. I believe we're now going to go to a short video, and we'll be back with you shortly.
You should continue to discharge your responsibility by contributing as much as possible towards this project.
The vision for the new Masroor Centre for Healthcare is to provide high-quality care at affordable prices for underserved communities in Ivory Coast. Work began in 2013, and by 2017, design began at the selected site. In 2020, the ground was levelled, and last year the perimeter wall was erected and the foundation stone was laid. This year construction has accelerated and the walls have already reached roof level. We urgently need your help to complete the build and go live. Join us on Friday 15th July from 6 to 9 p.m. British Summer Time at www.humanityfirst.org.
Assalamu alaikum viewers, and welcome back to the Humanity First telethon for the Masroor Centre for Healthcare in Ivory Coast. I've just been informed that by the grace of Allah we have reached $65,000 today in terms of donations, alhamdulillah. So please keep continuing to call in and making your donations and making your pledges, because it's going towards something which is a vitally important project in Africa. I'm delighted to say I'm now joined by Nasser Khan Sahib, who is serving as Naib Amir for the UK, and also Afsar Aslana, and is somebody who's been a regular donor for Humanity First. I'd like to welcome Khan Sahib to the studio.
Assalamu alaikum.
Wa alaikum assalam wa rahmatullah. Khan Sahib, you're somebody who's travelled to Africa often. Can you just tell us a little bit about your experiences in Africa, particularly in relation to daily life and what you've observed in terms of the healthcare facilities that exist in the continent?
Bismillah ar-Rahman ar-Rahim. First and foremost, as you know, I'm from Africa. I was born in Tanzania, so that's my birthplace. So I have a great affection for Africa, of course, and the African people. And but it's to my great regret that I've never been to West Africa, although some of my best friends are West African. And
at the inauguration, inshallah.
Inshallah. I'd love to do that. And I think the connection with West Africa is, for Jamaat, is obviously very strong. And Hazur himself worked there many years, as everyone knows. So I know that when I was a Qaid in many years ago now, in Lambeth, and we had a unique Jamaat that was, I think it was unique in the sense that almost everyone, barring myself, was from West Africa.
Yeah, I think I remember that, yes. I was only a small child, but I do remember.
And Khalifa Rabi Rahmatullah was very, very loving towards this Jamaat and gave us a lot of time at Ijtima'as, more than all the other Jamaats put together.
Yes.
So when we would hold our little camp in Islamabad in those days for Ijtima, I have fond memories of Hazur coming to our camp and meeting each and every one of the West Africans, because there were so few, maybe 50 or 60 West Africans in the Jamaat at the time. And he treated them with so much love, each and every one of them, because they were unique. There were very few of them.
Mm-hmm.
So in that sense, my connection with West Africa bonded very early in my days as Qaid in Lambeth, as I said, back in the early 80s. And so one of the great regrets that I have, although I have, as you quite rightly say, have connection with many fundraising events in West Africa, but this particular one catches everybody's imagination. One is because it's come at a time where I think the world can do with some good news, and although the Jamaat has so many wonderful projects all over the world, right now I think it's something that's focused everybody's attention, and it'd be lovely that we can have a beautiful hospital opened up, a state-of-the-art hospital in a part of the world that desperately needs all the help it can get. And having seen some of the difficulties in East Africa, and East Africa, bear in mind, places like Tanzania and particularly Kenya are very advanced comparatively to some of the West African countries, Ivory Coast in particular. But even there you will find huge problems with people's way of life, where water is not available, where medical care is almost non-existent, and the people suffer enormously. And the smallest thing, I mean, I go to Tanzania quite often, go back to visit my birthplace.
Yes.
And I often find that small things make people so happy. Even if you buy a box of paracetamol for someone, they think that you've given them the biggest gift you could give anybody in the UK. You could buy somebody the most expensive clothes, but they would not be impressed the way those people are so grateful and so kind in their generosity. Were they generous in their prayers. And
so in many respects, Khan Sahib, this a facility of this stature is going to be a complete game changer.
Absolutely. So it's from that exactly what you're saying. So now we're talking about something in a completely different scale. And from what I've seen in the pictures and everything else, and the video that's been shown repeatedly, I mean, I cannot believe that we're looking at Africa, in the middle of Africa, in a very poor part of Africa, that we're going to build something that will be anybody can be proud of anywhere in the world.
Indeed. In fact, just as a final thought, I know that you've spent as part of your day job, you work in real estate, and so you're very familiar with buildings. By the grace of Allah, you've had the opportunity to work on many Jamaat projects.
I'm glad you brought that up. I'm glad you brought that up because I'm just looking at what we've done here at Battle for Two and how many other mosques. We've built 26 mosques in the last 20 years by the grace of Allah. But Captain Majid Saab's standard of workmanship, and he's obviously a proven track record with the Guatemala Hospital as well and all the Tide Institute, etc. The standard is, mashallah, as good as anything that we could build here. And for the sort of money that he spends and the way he's very thrifty with the way he constructs things, I think we're very blessed to have him leading these projects. So I mean, I'd love to have him here. he could take some of our projects.
He's here, I think.
Yeah, no, he doesn't want to stay. I just spoke to him. He doesn't want to stay here. He wants to go as quickly as possible. So I was trying to persuade him to stay for Jalsa and maybe get him here afterwards. But no, he's going back to.
Well, Jazakallah Khan Sahab for joining us.
No, you're
We're very
most
grateful
welcome,
for your
and
time.
keep up the good work. And everybody should donate generously to this wonderful cause. Allah
Jazakallah.
bless you all.
We're off to a short video now. Jazakallah.
Jazakallah. Assalamu alaikum.
Treat all the creation of God with such deep love as though they are your close family members. Treat mankind in the same way that a mother treats her child. This is the way you should be, not that you help someone only so that you can attain benefit later or take a favor in return. It is my prayer that this proves to be the first of many humanitarian projects established by Humanity First. With all my heart, I hope and pray that it fulfills its mandate and proves an exceptional means of alleviating the suffering of people regardless of their religious beliefs, regardless of their age, and regardless of their ethnic or social backgrounds. I pray that it provides the best possible care for patients and that the doctors and staff work tirelessly for the sake of providing relief to people, especially to those who are poor and deprived. It is my prayer that the administration manages the hospital in a way that the poorest people who cannot otherwise afford treatment are offered heavily subsidized care and, wherever possible, free treatment.
Gracias a Dios me atendieron excelente. Todo lo que tengo que hablar aquí es bueno, pues. No tengo nada malo. No me llevo nada malo de acá. Ya con otro semblante, ¿verdad? Porque como venía en calidad de muerto, pues se veía. Y gracias a Dios, pues.
Assalamu alaikum viewers, and welcome back to the Humanity First telethon for the Masroor Centre for Healthcare in Ivory Coast. We just heard the very inspirational words of Hazur Aqdas Ayyadullah Ta'ala bin Nasr al-Aziz in relation to the Nasser Hospital in Guatemala, which was one of the recent major projects undertaken by Humanity First, building a hospital for the very first time in Guatemala. And indeed now we're raising money for another hospital in Ivory Coast, which will be the next major project, inshallah, undertaken by Humanity First. And in this segment, I will, inshallah, be joined by three individuals who have an important role to play in both raising the money and delivering this hospital. And the first guest that we've got on the line is Dr. Aziz Hafiz Sahib, who is the chairman of Humanity First UK. Assalamu alaikum, Dr. Saab, are you on the line?
Alaikum salam. Yes.
Assalamu alaikum, Dr. Saab. Thank you so much for joining us. It looks like you're joining us from home up in Bradford.
Yes, in England.
Unfortunately, yes.
The internet's still working up there.
Oh, very much so.
Dr. Saab, you are currently serving as the chairman of Humanity First UK by the grace of Allah, and the Masroor Centre for Healthcare is a project which is being looked after or developed jointly by Humanity First UK and by Humanity First Canada. Those are the two donor countries who've been given the responsibility for raising money for this project. Can you just tell us a little bit about the efforts that Humanity First UK is undertaking to raise money for this very vital project?
Absolutely. Thank you very much, Tariq Saab. Exactly as you've said, it's a huge responsibility for us as Humanity First UK, with our donors across the UK, to actually bring in the funds to build this flagship hospital. In terms of the efforts that we make, it is literally traditional fundraising, going door to door, actually selling to our donors out there in the country as to the benefits of what this hospital will be. And I think for people, and particularly for viewers out there, to actually have to understand why we would ask you to partake in this subject, in this project. So if I can share with you some of my personal experiences, as a doctor myself, having volunteered in Ivory Coast, in Ghana, in Gambia, in Guinea-Bissau, I've firsthand seen the pain and the anguish when literally you have a young child in your hand. With my own eyes, with whatever skill that God Almighty has blessed me with, I am unable to do anything for that child because we're in the middle of a situation where there is no hospital care, where the nearest basic health facility is 10 hours drive. And even then, you struggle to actually provide the basic essentials. So I'd say to our donors, and what we say to our donors is, when you see this and when you see it with your own eyes, when you experience it, when you touch those patients that without these facilities are unable to survive, it hits home that actually this is a very small price to pay. I mean, this is a very small price to pay to fund a state-of-the-art hospital that literally will revolutionize healthcare for multiple rural populations in Ivory Coast. And I would urge our listeners and our regular donors that have supported us these last few years to please continue to do so, but also bring in others. They say seeing is believing, and many of our volunteers, you've experienced them yourself. The reality on the ground is people are struggling for basic healthcare, sadly.
And Dr. Saab, on that, you yourself have had the opportunity to travel to Africa many times, and indeed to West Africa and the Ivory Coast. Can you tell the viewers a little bit about the conditions in Abidjan and the neighboring areas, and why a facility like this is going to make such a big difference to their lives?
Exactly. As I was just highlighting, those are the very reasons why it will make a difference. Parts of the Ivory Coast, you've got zero access to substantial healthcare. The long distances people have to travel. In one of the clinics in Ivory Coast that I served in myself 2 years ago, we were at pains wishing for a healthcare facility that would help treat some of those children. And I think with this healthcare facility, it really will revolutionize care for the average person on the ground. I really cannot overemphasize how important and crucial this hospital will be. I mean, everybody's called it a game changer. It literally will be a game changer.
Jazakallah, Dr. Saab, for those very insightful words. Allah bless you for all your efforts. And inshallah, we look forward to having you with us again soon.
Thank you. Assalamu
alaikum wa rahmatullah. Next, we will be traveling from Bradford in the UK to Canada, all the way across the Atlantic Ocean. And I believe we are joined by Dr. Aslam Daud Sahib, who is the chairman of Humanity First Canada. Assalamu alaikum, Dr. Saab. Assalamu alaikum. Is Dr. Saab on the line? Assalamu alaikum, Dr. Aslam Daud Sahib. Can you hear us? We appear to be having a slight technical challenge. I'm sure that we will get Dr. Aslam Daud Sahib on the line very shortly. But viewers, as Dr. Aziz Saab was telling us, he himself has been to Abidjan, he's been to the site, and the conditions that people live in there are not conditions that we living here in the West and in developed countries could really even fathom. They have very, very basic facilities when it comes to healthcare, and that is why a project like this is so critical. So I would really urge our viewers to dig deep and to make donations for this very important project generously. Obviously, we're here to take cash donations today, but for those who aren't able to make a cash donation today, making a pledge is equally as important and something that you can pay off over the next 12 months. And one of the reasons why we're holding the telethon today is that by the grace of Allah, the building work is developing very quickly, and there's currently a need for funds in order for the progress of the construction to continue at the pace it is. I believe we've got Dr. Aslam Daud Sahib back on the line now. Assalamu alaikum, Dr. Saab, can you hear me?
Walaikum assalam. Yes, I can hear you very well.
Assalamu alaikum, Dr. Saab, and welcome to the telethon. Dr. Saab, as I was mentioning earlier on, this project has been the responsibility of this project has been given to both Humanity First UK and Humanity First Canada. Very important project for the Humanity First family. Can you tell us about some of the efforts that HF Canada is making in raising awareness for this project and for raising funds where you are?
Yes, it's a very important project because when Huzur Anwar assigned it to the HF UK and Canada, this was the biggest project that we have done, so we had to really make a special arrangement. So what we did was we reached out to all our donor base, plus businesses and other people, and started creating awareness about this hospital, what it will be, how it will be located. We presented the model of the Nasser Hospital in Guatemala, and also the hospital that we are running in Senegal, that these two. So there was a track record of that. Humanity First is already providing healthcare through hospitals, and this would be a project that would be funded by Canada partially. So there was a lot of interest, and we were especially targeting people to give some larger donations so that they can sponsor a portion of the hospital. So that worked out, and then when we did the telethon, we invited everyone to make a pledge that can be paid in 2 or 3 years. So that gives them some leverage to make a larger pledge. And as a result of that, we have a number of large...
I think we've lost Dr. Sahib. I'm sure we will try to get him on the line shortly. Again, as I was saying before, Dr. Saab joined us on the line, that at the moment, by the grace of Allah, the construction of the hospital is moving forward at great pace. The boundary wall has gone up, the foundations have been laid, the external structure is up, the roof is going up. And you know, the next phase of the project is now to start developing that further, working on the internals, etc., etc. We'll be joined by Humanity First colleagues later on in the show just to talk us through the progress that has been made. And that's why it's so critical that we get funds in right now, so that the project is not delayed in any way and it's able to continue along the construction program that is anticipated, which by the grace of Allah is going ahead at speed. And I believe we are now being joined by Dr. Shabir Bhatti Sahib, who is serving as both Naib Amir UK and as Senior Vice Chair for Humanity First International, and also Chairman of the Board for the Masroor Centre for Healthcare. Assalamu alaikum, Dr. Saab, can you hear me?
Wa alaikum assalam wa rahmatullah. Can you hear me?
I can hear you loud and clear. Jazakallah for joining us on the show. Dr. Sahib, you obviously are intimately involved with this project as the chair of the board and as a member of Humanity First International. Can you tell us why this project is so important for the people of Abidjan?
Well, the simple answer to that is because the Khalifatul Masih of the time has directed us to do this. So there are many reasons, many places, many people, many areas that request help to be given to them regarding healthcare and various other things. And the request from the Ivory Coast to Huzur Ayyadat Allah bin Nasr al-Aziz was received, and we were marked to try to fulfill this great honor by fulfilling the needs of the people, but foremost by also being able to fulfill the wishes of our Supreme Commander. So I think that's the most important reason why we are involved in this project. And hopefully also, because the Promised Messiah, ﷺ, who the Khalifatul Masih represents as well, has said that the purpose of his coming on this earth is only twofold. One is to get the people to be acquainted with with their Maker, and to fulfill the rights of the creation of Allah Almighty. Hopefully we're able to fulfill the second part as best as we can.
Inshallah. And are you able to share with us any guidance that Huzur Aqdas Sayyidat Allah bin Nasr al-Aziz has given to you specifically in relation to this project?
Yes, Huzur has we have been very worried about the funding issues that that are normally attendant with the projects of this size. Now, this is the largest project Humanity First has been involved with in Africa. Possibly, I think it probably will surpass the Nasser Hospital project as well. And we approached Hazrat Sahib and requested that we are really worried about this project. And he says that, look, you should try to work with this honestly as best as you can. And as long as you're honest with it, do not worry about the hurdles that come in the way. They will all fall apart, fall down. So you just carry on as best as you can with the proper intention, and don't worry about the funding. So that was very, very, very reassuring to us. And even though it looks very difficult, but the Jamaat, mashallah, is so obedient, resourceful, and generous that we do see funding coming in whenever we ask, and even from other sources. So we're very lucky from that point of view.
Alhamdulillah. Very, very reassuring words from Huzur Anwar Ayyadat Allah bin Nasr al-Aziz. And Dr. Saab, just before we let you go, is there any final message that you would like to give to our donors who are watching the telethon today?
Yes, I would like to say, these bricks that you have on your table, I have got an anonymous donor who has decided to donate the diamond disc, a brick, I should say,
Mashallah,
for £10,000. And they do not wish at this stage to be identified, so it's anonymous, as I said. And they want to donate it on behalf of the Holy Prophet Muhammad sallallahu alaihi wasallam and all those who love him.
Amazing. I'm never cease to be amazed by the generosity of our donors, and they are just so truly inspirational, and it just shows the divine succor that Humanity First as an organization has under the guidance of Huzur Aqdar Sayyid Al-Amlas Disease. Dr. Saib, Jazakallah.
There is one important message that I just want to relay before you let me go, or I let you go, I should say. And that message is that I have approached several people for the donation of this project in this manner, that this is a rare opportunity to buy into some real estate, because the price of this real estate, if you buy in now, will never fall, and the returns will go on coming to you even after your death. Sadaqah Jariyah, as was being explained last time. So as long as the hospital stands, as long as the people who have benefited from the hospital stand, and their kids and their progeny, the sadaqah, the alms that you have given will keep on benefiting you. So this is a rare opportunity. Well, I wouldn't say rare. It is an opportunity to buy into real estate, which is at a very competitive price, very, very competitive price, and it will just keep going up in value.
Indeed. Jazakallah, Dr. Sahib, for those words. As Dr. Sahib said, you're buying into real estate, which gives you returns into perpetuity in the form of Sadaqah Jariyah. Jazakallah, Dr. Sahib, for joining us. We are very grateful. Assalamu alaikum. I believe we are also now joined by a 7-year-old donor to the project. Her name is Dia Dani. Dia, are you on the line? Assalamu alaikum.
Yes.
Dia, how are you?
Good.
Good. Thank you for calling in. Dia, are you 7 years old? Is that correct?
Yes, I'm 7 years old.
Mashallah, mashallah. And Dia, do you want to tell us why you decided that you wanted to give some money to this hospital?
Because my Nana and Dada have passed away.
So you're giving it as a donation on behalf of your grandparents, I believe.
Yes.
Mashallah, that is very, very inspirational. And Dia, have you ever been to the Ivory Coast?
No.
Would you like to go one day?
Yes.
Inshallah. Well, I'm sure if you ask your parents nicely, I'm sure inshallah one day, once the hospital is built, inshallah, they will take you to the Ivory Coast and you can see what your very generous donation has contributed to. Jazakallah for calling, Dia. It was a pleasure to have you. Assalamu alaikum. I believe we're now going on a short break. We'll be back soon, inshallah.
Treat all the creation of God with such deep love as though they are your close family members. Treat mankind in the same way that a mother treats her child. This is the way you should be, not that you help someone only so that you can attain benefit later or take a favor in return. It is my prayer that this proves to be the first of many humanitarian projects established by Humanity First. With all my heart, I hope and pray that it fulfills its mandate and proves an exceptional means of alleviating the suffering of people regardless of their religious beliefs, regardless of their age, and regardless of their ethnic or social backgrounds. I pray that it provides the best possible care for patients and that the doctors and staff work tirelessly for the sake of providing relief to people, especially to those who are poor and deprived. It is my prayer that the administration manages the hospital in a way that the poorest people who cannot otherwise afford treatment are offered heavily subsidized care and, wherever possible, free treatment.
Gracias a Dios me atendieron excelente. Todo lo que tengo que hablar aquí es bueno, pues. No tengo nada malo. No me llevo nada malo de acá. Ya con otro semblante, ¿verdad? Porque como venía en calidad de muerto, pues se veía. Y gracias a Dios, pues.
Je m'appelle Doumbia Ali. L'hôpital dans ces quartiers, vraiment, nous sommes beaucoup contents. Si dans quelques temps, peut-être, si Dieu nous a aidés, ça va finir. Ça va beaucoup arranger les parents du quartier. On est dans un grand quartier, il n'y a pas d'hôpital, il n'y a rien. Donc vraiment, si cet hôpital finit, Inch'Allah, ça sera vraiment quelque chose de très bon pour les habitants d'ici. Bon, vraiment, on a beaucoup une difficulté à ce niveau dans le quartier. D'abord, il y a le problème de route. Et puis le deux, quand il y a ce genre de cas tardivement, c'est un peu difficile parce que les centres de santé qui sont vers ici, ils sont un peu loin. Vous voyez, ils sont un peu loin. Donc, d'ici, on va quitter ici. Moi-même, j'étais dans le problème. Quand je suis tombé malade, j'ai eu ce problème. On a eu des véhicules pour aller, mais d'ici on va arriver là-bas. Vraiment, il y a beaucoup souffert. Donc, l'hôpital dans le quartier, dans le secteur ici, c'est une bonne chose. Vraiment, nous prions que cela finisse vite. Ça va beaucoup soulager la population de ces quartiers.
Assalamu alaikum viewers, and welcome back to the Humanity First telethon for the Masroor Centre for Healthcare in Ivory Coast. We've just received an update that we've raised, alhamdulillah, $170,000 in cash since the start of our live feed by the grace of Allah, alhamdulillah. We still have over an hour to go, so please do donate generously whilst the program is still running. I am joined at the moment in the studio by Dr. Hamad Khan Sahib, who is the Medical Director for Humanity First UK. Welcome, Dr. Saab.
Assalamu alaikum, Tariq. Thank you for inviting me here today. Really exciting.
Pleasure. Dr. Saab, you've, alhamdulillah, led a number of medical delegations to Africa. Do you want to just tell us about some of your experiences, particularly with respect to healthcare provision in the continent, in the places that you've been?
Yes, I think that we're talking about the Masroor Centre for Healthcare in the Ivory Coast, and really throughout all of sub-Saharan Africa, there are huge challenges around access to healthcare, the provision of healthcare, what is available for people to be able to just get to a hospital and to be able to get the care that they need. I have been to Uganda, I've been to the Gambia, and most recently to the Gambia just 2 months ago. And when I go there, I work with local clinicians, local nurses, local doctors, and we have a team that goes. But you know, the starkest thing is, I work here in the UK in the NHS. Colleagues who go out with me, they also work in the NHS. And we're so lucky. It makes you realise how lucky we are, both as people who work in the NHS and people who have access to the sort of healthcare that the NHS provides, that there are doctors and nurses, there are the hospitals available, there's supplies within the hospital, there are machines that work, there are people that can maintain the hospital, so much. And then you go out to somewhere like the Gambia or Ivory Coast, and you see that actually it isn't so easy. And you might go to a hospital and you might want to get some treatment, but the medicines aren't available, or the supplies aren't available, or the doctors and the nurses are stretched. And whereas in this country, you might have the availability of 5 or 6 or 7 nurses on a ward, you go to somewhere in sub-Saharan Africa, and you might only have 1 or 2 nurses to a ward. So really stretched, and sadly it does mean that the level of healthcare that people are able to get is not great, is not as good as it is here, and it's not due to a lack of dedication of the people who are working out there. Mm-hmm. Absolutely not at all. They're incredibly dedicated, incredibly hard-working individuals. But what they lack is resource, and what they lack is the buildings, what they lack are the facilities to be able to provide the healthcare that they know they want to give. And the hospital that Humanity First is building, the Masroor Centre for Healthcare in the Ivory Coast, is an example of the sort of hospital that will mean that local people, as in local clinicians, doctors and nurses, are going to be able to provide the sort of healthcare that they want to provide to the people in their community.
That's very interesting. I mean, can you expand on that? Because obviously a lot of thought has gone into the design of this hospital, the services that it's going to provide, and how it's tailored to serve the local community. Can you just talk us through, what is it that's going to be different about this healthcare that is going to mean that it's tailored for the needs of the local community?
One of the biggest challenges around being able to provide good healthcare in any part of the world is being able to afford that healthcare. Not just in terms of the individual affording that healthcare, but in terms of society, wider society, being able to afford that healthcare and being able to put enough money into it in order for it to run well. So what we might call a sustainable model of healthcare. That's what we're all looking for. Even here in the UK, that is what we're looking for. And so in order to be able to get to a position where you've got a sustainable model of healthcare, you have to have the right facility, the right hospital, kitted out in the right way, but run in the right way. And this is one of the areas where Humanity First, by the grace of Allah, is able to excel, because we have a proven model of sustainably running hospitals that works.
Alhamdulillah.
And inshallah, the plan for the Masroor Centre for Healthcare in the Ivory Coast is that it will run along exactly those sorts of lines. So it will be run in a way that is sustainable. So it will be run in a way that means that year on year, the hospital is able to continue to run. And Humanity First will continue to support it from a financial perspective to ensure that it is able to do the work that it needs to do, but more importantly, we'll continue to support it from an administrative perspective, we'll continue to support it from the perspective of how it's run. Because a well-run hospital, a hospital with good governance, with good administration, is a hospital that will be successful through to the future in a sustainable way and will be will continue to be able to provide healthcare to the whole community.
Indeed.
And one last thing, one of the aspects of this that's really, really important is that there are members of society, especially in the poorest parts of the world, who are sadly most overlooked in terms of their provision and access to healthcare. And in general, that is children and women. And the reasons for that are that there is, unfortunately, a financial gap. Children don't earn money. Their parents do, but children don't earn money. And women everywhere in the world, but especially in the poorest countries in the world, tend to earn less money than the male members of their family. And that is a simple reality. And so it means that they cannot afford access to the same sorts of services. But Masroor Centre for Healthcare is an example of a hospital that will be able to close that gap and provide healthcare to the most vulnerable in society. And that is such an important thing, because otherwise those individuals would not have access or would not have good access to that sort of healthcare. And we're talking about individuals who otherwise would suffer throughout their lives or would even sadly die because of a lack of access to healthcare.
No, Jazakallah for that, Dr. Saab. So it's not just about the building itself, but it's the fact that it's serving the most vulnerable in society, and most importantly, it's sustainable, which is so key. And I believe we're also being joined on the line by Dr. Azhar Siddiq, who is a member of Humanity First UK, who runs one of our food banks in the Midlands. Dr. Azhar, are you able to hear me? Wa Islam, Dr. Azhar, how are you?
I'm very well, alhamdulillah. You're very well yourself?
Yeah, very well, alhamdulillah. Jazakallah for joining us today. Dr. Azhar, I know you're a doctor by profession, and that's your day job, but you also run the Humanity First food bank in the Midlands, but also you're a regular participant in medical trips that take place, taking clinicians from the UK into different parts of Africa. Can you just tell us about your experiences as a volunteer for Humanity First, providing medical care in the continent of Africa?
Yes, of course. Assalamu alaikum wa rahmatullah, and thank you for having me and inviting me. Yes, I mean, in short, these experiences have been nothing short of eye-opening. I volunteered, by the grace of God, had the opportunity and the privilege, and it is a privilege, to volunteer in the Gambia some years ago, but more recently have led a couple of medical trips to Ghana. Now, the whole of West Africa is very similar in its healthcare landscape as to what's already been described. And it's only when you get on the ground in these areas that you begin to understand the difficulties that these people face. We went to the Upper West area, which is an area of quite extreme poverty in the north west part of the country. And the major problem is access to healthcare. So they have long distances to go to get to any form of healthcare. And when they get there, the prices that they are charged to access that healthcare is prohibitive for them. So this leads to a number of healthcare problems. But it's not only that, it's also that they don't have any form of primary healthcare setup in their communities. So we unfortunately here sometimes give our general practitioner colleagues a hard time, but they work exceptionally hard in difficult situations. And in a place like Ghana, they have no primary healthcare setup at all. So what the patients do is that they go to herbal doctors or other types of faith healers, and invariably their conditions are not resolved in any way by attending these practitioners, and they end up trying to access healthcare at the end of the day in a much worse situation. And it's for those reasons, and also additionally because of the complete absence or distinct lack of any sort of primary healthcare education, that we see so many advanced cases of disease, that we see so many complications, that we have such a high maternal
has been alluded to by Dr. Ahmad Saab already, and neonatal death rate, which a rate which would be unacceptable in our environments, and from simple controllable diseases, from uncontrolled diabetes, from uncontrolled hypertension, postpartum, antepartum hemorrhage, education of women pre and during labour, and pediatric neonatal mortality from infections, from measles, from sepsis, from malaria, and malnutrition. So these are very avoidable things, and this is why a healthcare institution such as the Masroor Centre, which is being set up, which will provide a very high quality healthcare for all communities, for all peoples, irrespective of their background, is such a valuable asset in this type of healthcare environment. And we hope and pray that that people contribute generously to it, and that this is a primer for other, inshallah, similar successful projects across West Africa.
Inshallah. And Dr. Saab, just in light of the background that you've given to us with respect to the general healthcare facilities and conditions that exist in some parts of Africa, just talk us through in what impact a facility like this is going to have on the daily lives of people that live in and around Abidjan in the Ivory Coast.
Oh, it's going to be huge. One of the problems we find in parts of West Africa is not only accessing healthcare, but when you get to that healthcare facility, the resources available there are so minimal and are way below the standards that we'd expect in this country. And that's, as Dr. Marzab said, that's not due to the fault of the people who work there, who are so dedicated to their work, but it's due to things out of their control. They just do not have the facilities to offer the level of healthcare that they want to offer, and that their patients deserve. And this sort of facility, inshallah ta'ala, which is a first world facility, which will be staffed by high quality healthcare professionals, will be a game changer, a complete game changer, for not only that part of Ivory Coast, but for all the regions around there, giving people of all backgrounds access to exceptionally good quality care.
Inshallah. And Dr. Matsab, I just want to pick up on a point that Dr. Azza made a short while ago about when healthcare is available, it can be inhibitively expensive for the poor. So can you just talk us through how the Masroor Centre for Healthcare is going to be different when it comes to the provision of top quality healthcare for the most vulnerable in society?
Absolutely. I think there is a principle here in terms of provision of healthcare, and a principle we hold very dear in this country, which is that care is provided free at the point of need. And the World Health Organization and other big developmental organizations around the world are very focused on this idea of healthcare that is free or costs very little at the point at which it is required. When you go to a country like Ivory Coast, you will find that you can have access to good quality care, but in order to get that, you have to pay a lot of money. And the amount of care that is available is very limited, so it's not available to everyone. So you have to be very rich and you have to be part of the elite, essentially, to be able to afford that. What is the fault of the ordinary person? What is the fault of ordinary individuals that don't have that sort of access? So the thing that this healthcare facility, that this hospital will provide, is that sort of direct access for individuals who will not have to pay exorbitant amounts of money as they would do otherwise. And actually, it starts to level the playing field hugely. And it means that whoever you are, you can go to the Masroor Centre for Healthcare and you can get the sort of care that you need at the point at which you need it, without having to think about how am I going to be able to afford this.
And that's, I mean, that's so important, because here in the UK with the NHS, we take that completely for granted, don't we? It's free at the point of use. You know, heaven forbid, should somebody get unwell, they're able to access the hospital, accident and emergency, they can go, they can turn up, they'll be seen, you know, within a few hours. And if they're able to wait, they can go and see their GP. So we're so used to having primary care here in the UK, and indeed in most parts of the developed world. You can healthcare, emergency healthcare in particular, is free at the point of access, and that's something that is not available to the poorest people, some of the poorest people in the world, who arguably are in need of it most.
Absolutely.
There's people in the developed world who are capable and able to pay for their healthcare, but in spite of that, they get it free. So it's very sad when those who aren't able to afford it are being charged huge sums of money for what is very, very basic care.
Absolutely.
So, you know, that's why viewers, this particular project is so important, and we would urge you once again to dig deep and to give generously. Alhamdulillah, by the grace of Allah, we've raised a significant amount of money just during the course of the last couple of hours. The money is continuing to come in, and we are humbly requesting people also to make pledges, such that if you're not able to make a donation today, then over the next 12, 24 months, when you are able to, you can make a donation. And as we've mentioned earlier on, this project is moving ahead at pace, and we need to keep up with the payments for the contractors and so on and so forth, so that inshallah we're able to develop this facility, this amazing facility, in time, so that it can start benefiting the local people as soon as possible. With that, we'll bring this segment to a close. I just want to say Jazakallah to Dr. Hamad Sahib and to Dr. Aziz Sahib on the line for joining us. Inshallah, we'll be back after a short break.
Treat all the creation of God with such deep love as though they are your close family members. Treat mankind in the same way that a mother treats her child. This is the way you should be, not that you help someone only so that you can attain benefit later or take a favor in return. It is my prayer that this proves to be the first of many humanitarian projects established by Humanity First. With all my heart, I hope and pray that it fulfills its mandate and proves an exceptional means of alleviating the suffering of people regardless of their religious beliefs, regardless of their age, and regardless of their ethnic or social backgrounds. I pray that it provides the best possible care for patients, and that the doctors and staff work tirelessly for the sake of providing relief to people, especially to those who are poor and deprived. It is my prayer that the administration manages the hospital in a way that the poorest people who cannot otherwise afford treatment are offered heavily subsidized care and, wherever possible, free treatment.
Gracias a Dios me atendieron excelente. Todo lo que tengo que hablar aquí es bueno, pues. No tengo nada malo. No me llevo nada malo de acá. Ya con otro semblante, ¿verdad? Porque como venía en calidad de muerto, pues se veía. Y gracias a Dios, pues.
Assalamu alaikum wa rahmatullahi wa barakatuhu. We are back, myself and my trusty companion, Dr. Majid Saab. As you already know, I mean, right now, Dr. Saab, Majid Saab, Captain Saab. I got doctors, I got captains. We've got everybody here right now. But one of the things that I think we both agree on, that we're at around 170,000 right now, and our goal is 300,000 pounds. And so the 300,000 pound question here is, how many of you are out there supporting this blessed opportunity to build a hospital in Ivory Coast? The bank details are there on the screen. And before because I have a whole bunch of crazy questions for you that I think myself and I think a lot of our audience members really want to know. Many of us are not as involved in this project or building hospitals in any country, let alone in Africa. So we've got a lot of questions in that regard. But okay, so I now understand that we've just gone over 200,000. So that's just awesome. That's blessed. That's
absolutely. And I would just add on to that they don't have to pay it today. They don't have to even pay it within a month.
Right.
So if they can pledge today and then keep on paying for the next 1 year or so, that would be, that would really add on to this amount.
Yeah.
Because if you're allowed to pay over time, and then of course as the project needs it, then it is we can just request the donors that don't think that you have to be paying it within a month or so. You can take 12 months or even 15 months if the amount is bigger.
Right, and I think that that's very important, because I think we all have to keep in mind that brick by brick, the house or the hospital gets built.
Absolutely.
So it's a matter of not only the big amounts. The big amounts are blessed. We all agree. Of course, we'll never turn away big amounts. And I think that if the intention, if the good intention of a person is to do this for themselves, for their children, in the memory of a loved one, these are the opportunities that I think we need to be taking advantage of, whether it's big or whether it's the size of a small brick. Brick by brick, the hospital gets built.
Yes, absolutely.
One of the questions that I think a lot of us really wanted to know, because right now anybody who dials into the internet, turns on the TV, they see everything happening in the world, right? So I'm sure a lot of our audience members are really happy to hear that we're building a hospital, right? But the real question, I suppose, for some is, why Africa?
Well, I think probably many of the viewers will not know that this century the world will start seeing the population going down after 2080 or maybe till by the turn of the century. During this time, Africa, in the meantime, and average fertility rate of the world today is 2.4. Whereas the sub-Saharan Africa has a fertility rate of 4.7.
Wow, double.
Which is double. And what does that mean? That means that by the turn of the century, 40% of the world population would be coming from Africa. That also means that it is, by the way, Africa is also called the youngest continent. 40%, one age from 1 to 15, 40% of the population is till the age of 15.
Wow.
Now, and you also understand the population inertia. You can't stop it straight away.
Yep.
Even if you start thinking about it now, it starts happening after 50 years.
Right.
So the next world workforce will be from Africa, with Europe population going down, with China's population expected to go down around 380 million people by the turn of the century. So the workforce of the world will come from Africa.
Wow.
And that also means that they would need the most investment in healthcare as well as in education.
Okay, so then I've got one question for you, but just before I ask you that question, I just want to remind our viewers, the bank details are there on the screen. Please, we've got 7 minutes left. 7 minutes before we conclude the program, which means that 7 minutes is your opportunity for yourself, for your friends, family, and loved ones. So you've got 7 minutes to really try to step in and do something for this blessed scheme.
Yes.
The second thing that I wanted to mention for you, Captain, is now you painted a very extraordinary picture of what we now know is happening in Africa. So out of all of the countries in Africa, then why Ivory Coast?
So it could have been any country, fine. But Ivory Coast specifically because in the region, in the West African region, Ivory Coast has the highest preventable mortality rate.
Wow. Okay.
That means that that country needs support in healthcare. That is the reason we chose Ivory Coast. And Ivory Coast you can actually have, once this hospital comes that's the first phase we are making. The next phase could be increasing the facility and the size. And then later on, we'll start putting in satellite clinics right into the other countries.
Wow.
So that way, this hospital can eventually become a tertiary care hospital. And the Ivory Coast is and our location is just on highway going to Burkina Faso and Mali. So it is perfectly placed for people to travel and come to Ivory Coast. And this is not, I'm not talking about
hold on. Sorry about that, Captain. Speaking of blessings coming our way,
okay,
we've got a caller on the line.
Okay.
He's from Bosnia and an early member of Humanity First, who from what I understand, is going to be giving a very large, wonderful donation. It's 10,000. So 10,000 from Mr. Ghulam. Are you here on the line with us?
Yes, I am. Assalamu alaikum.
Wa alaikum salam wa rahmatullah. Ghulam, thank you so much for your contribution. What was it that inspired you?
Well, the number of places that Humanity First is actually helping, and this is something quite close to my heart, and I do contribute to Humanity First ever since it came into existence since way back during the Balkan War in 1995. And I continue to support Humanity First because of all the good work they're doing all over the world.
Thank you so much for your support. We're running out of time, but I really want to ask you one more question, and that is, what is your message to everyone listening now? What is your message to them, and why should they donate to this hospital?
Well, my message to everybody is the message that I took from my father. My father was not a very educated person, and he's the one who I take my inspiration from. Even when he had very little to live on, he always paid his chandas without fail. And he instilled this into all of his children, including myself, and I try to do that so that my children follow my footstep and continue this wonderful humanitarian work, which we do and my children do as well. In a remote area of Azad Kashmir, we build houses for the poor people. Not many people in my family even know that. And so this was something that Sayyid Ayman Yahya mentioned to me. And I, said that, okay, I will contribute and buy a diamond brick. And may Allah accept this donation.
Ameen.
And I request your prayers. And that's all I can say.
Thank you so much. I really appreciate this, Ghulam Sahib, and I'm sure I'm speaking on behalf of myself and Captain who is with me. We really appreciate it. As everyone here has just heard, Ghulam has brought a diamond brick, so that's 10,000, and so I really appreciate it. And I think please convey my greeting of peace to you and to your family, and we will also join you in those sincere prayers that God may bless your every effort.
And I would humbly request prayers for I have a disabled son who's 27, he's severely autistic, and I just request prayers for him.
Okay.
And that's what I'd like to request, yeah.
Okay. We'll certainly see you, Ghulam Sahib, in those sincere prayers of ours. Thank you so much, dear brother. Assalamu alaikum wa rahmatullah.
Wa alaikum salam.
I understand we have another guest, another donor, Jalaluddin Akbar. Jalaluddin Akbar Sahib, Assalamu alaikum.
Ji, wa alaikum assalam wa rahmatullahi wa barakatuh. Thank you for calling me. I was speaking to Nasiruddin Sahib and I asked him what a few things, and then he said, I'll call you in about five minutes.
Oh, right.
So it's your years. So what can I do for you now?
Well, actually, I just wanted to see if you had a quick message to the audience, and also what was the reason behind your donating?
I have been donating for quite some time earlier, also when we had it during the Jalsa Salana.
Okay.
By the grace of Allah, I have donated. And I was sitting now and I just remembered, and then I said no.
Right.
As our beloved Khalifa has also said, and he has also told us. So, and then thinking about those poor people over there who do not have the access to anything.
That's right. That's right.
So that is why you see that motivated me to.
All right. Well, God bless you. Thank you.
Something now.
Right.
And then inshallah, I'll be donating more in near future. So,
God willing, and may God enable you and all of our listeners to also donate
inshallah.
And follow in your pious example.
Because you see, whatever we do it for God's sake.
That's right.
Not for but just to get the appreciation from the world. That is out of question. It
That's
is
right.
only because Allah and His Rasul has said so. So we should do that.
That's right. Well, thank you so much for calling, and God bless everything that you do, you and your family.
Thank you very much. And I wanted to give some donation now. Is it through you or somebody else?
Oh, I think somebody else at this point will take over from this call, and they'll go ahead and accept your donation. Jazakallah. Thank you so much, Jalaluddin Sahib.
Okay, thank you.
All right. Assalamu alaikum warahmatullah. I understand we have about 1 minute left.
Okay.
So, Captain Saab, I have one quick thought in my mind, but I also want to give you the opportunity. So first, I was going to say age before beauty, but age before age. How's that?
All right. Thank you very much. Just one last thought, and as I said earlier, we normally people take it that they are sacrificing for something. This is not a sacrifice. You must consider this as an opportunity to serve, opportunity to give. And I would just request you that in the next 1 year or 15 months or so, please take this opportunity and donate as much as you can in your name, in the name of your loved ones. And so it remains, it can be as a sadqa jariyah for the times to come. Thank you so much, Jazakallah.
Thank you, Captain Saab. I will just mention this one thing to everyone. So, some time ago, I was asked to join some of my illustrious companions like Captain Saab, who's been here with me, and some of our wonderful callers, and all of our teams across Humanity First and outside of Humanity First has been making this happen. So I said, of course. So I was at work today, and I had to leave work and rush to come here. So I called a cab. So the cab appeared. I ran outside to jump into the cab, and it turns out the man turned around and he says, Hamza Liasab, Assalamu alaikum. And when I saw him and I recognized him, I said, oh my goodness, I can't believe you're my cab driver. So when he saw me and he says, oh, are you going to the telethon at Baita Futu? I said, yes. And he canceled the ride right then and there. And he drove me here for free. And I was able to make it here in awesome, awesome time. The point that I was trying to make is that right before I got out of the cab, he told me that someone shared to him, his son, shared to him this one very important thing. Someone asked him, why does he do things for the sake of God alone? Why does he work so hard for humanity? And you know what his son replied? He says, because in life, you only get one small bowl of salin and 1 or 2 chapatis. Meaning, you only get one small bowl of soup in life and 1 or 2 pieces of bread. That's actually all you need in life. Everything else is luxury. What we're asking you to do in actuality is, instead of enjoying day in and day out all of the wonderful luxuries that you and myself and Captain Saab here enjoy, instead of taking that for granted, take one of those pieces of bread, one of those chapatis, and give it to someone who doesn't have it and probably never did. Right? Let them at least get 1 spoonful and 1 piece of bread. I'm asking you, we're all asking you to please donate, please donate, please donate, and God bless you. And our last words are, all praise to Allah, Lord of all the worlds. Thank you for joining us here.
Thank you very much.
We really appreciate everything that you've said, all of the knowledge that you shared with us today, as well as all of our other guests. And we want to, of course, tell all of our listeners, God bless you. We'll see you in the prayers. Do donate for your own good, as well as for the benefit of the people in Ivory Coast. God bless you. Assalamu alaikum wa rahmatullahi wa barakatuh. Peace and blessings of God be upon you.